Alliance President come up and say a few words. Laura Dickson is a president of the Canadian Epilepsy Alliance. She's based in Calgary. She also serves as Director of Operations and Strategic Affairs for Neurological Health Charities of Canada. Each of these organizations exists to advocate alongside people who are implicated by epilepsy and other chronic neurological diseases. Laura brings over 2 decades of experience in public health and nonprofit administration and holds an MBA from Royal Roads University in Victoria, BC. A post-degree certificate in health promotion from Canadore College in North Bay, and a Bachelor of Science degree from the University of Toronto's University College. So, Laura, please come up.
It's no longer good afternoon, it's good evening. It's an honor to stand before you today at the opening of this year's annual scientific meeting, and I'm deeply grateful for the opportunity to share some of the experiences of the Canadian Epilepsy Alliance over the past year. I'd also like to talk a little bit about how the CEA as a patient advocacy group complements the work of leaders such as yourselves in epilepsy research, diagnosis, treatment, and disease management. As always, there is no shortage of ideas, innovations, and emerging opportunities to benefit the epilepsy community. However, the inequitable distribution of resources across public, private, and non-governmental sectors continues to present challenges to the work of charities like the CEA and its member organizations. If the past year has shown us anything, it has certainly strengthened our conviction that a members-based alliance advocating at the grassroots level on behalf of the estimated 1 in 100 Canadians living with epilepsy and those caring for them matters. At 26 member associations strong in communities across Canada, each of us is committed to improving the lives of Canadians affected by epilepsy. But as individual charities, we depend on donors and one-time grants to make ends meet. Each year, the uncertainty surrounding our annual budgets impacts our ability to plan much of anything beyond the short to medium term, and affects our ability to commit time and resources to partnerships, and continues to force hard choices in what we can do in our day-to-day work and who we can serve. But I can confirm that opportunities do shine down upon us, some very well worth considering in how the work of researchers, clinicians, and patient advocates can intersect and amplify impact. By sharing data, insights, and patient perspectives, we can enhance our understanding of epilepsy and improve treatment outcomes. For those we serve, access to promising new treatments is encouraging, and it's a source of hope. But affordability, coupled with shortages of existing therapies, causes stress and anxiety and difficult choices for patients and their families. This year, the CEA was pleased to participate in a national media awareness campaign championing the priority for governments and other funders to invest in the epilepsy community, respecting the rights of Canadians who live without adequate seizure control to have access to new and promising therapies. This campaign brought the patient perspective to the forefront where it belongs, highlighting the urgent needs, which also include non-medical needs like stigma, isolation, caregiver burnout, or underemployment, and other social and economic impacts of living with a chronic disease. As we advocate for access to new evidence-based therapies, together our voices, expertise, and experience carry significant weight and have a chance to influence policy decisions. Every day, epilepsy associations help educate local law enforcement, schools, workplaces, and the public on seizure recognition and response. This is crucial in preventing incidents like the one that took place on October 2nd, 2022 in Hamilton, Ontario, that despite readily available on-demand training through the Canadian Police Knowledge Network, resulted in the unfortunate and inappropriate policing response to an individual experiencing the postictal state in his workplace. And education and training can help ensure that this response is appropriate in classrooms, as will be the practice in Ontario thanks to a private member's bill that came into law this year. Widespread public education ensures that people with epilepsy receive the understanding, empathy, and support they need. Knowledge is an empowering tool that spreads awareness and helps reduce fear and stigma. Continuing to support, engage, and spread the word about research that values and prioritizes perspectives of people with lived experience is another opportunity. This year, Canada's participation in the Global Epilepsy Needs Assessment, led by the International Bureau for Epilepsy, has provided us with an unprecedented opportunity to gather valuable Canadian data on the unmet, non-medical needs of people with epilepsy and their caregivers. Data we hope will be instrumental in our advocacy efforts with government and with funders. QR codes here are for English and French surveys. Each survey takes around 30 minutes and is for adults 18 and over with epilepsy, as well as for parents and caregivers. Please feel free to share through any means available to reach eligible participants. The survey closes soon on October 31st, and we have these QR codes available in our booth in the marketplace outside. Finally, a word about the impact community-based programming can have on the lives of people with epilepsy and their families. Community-based programs delivered by the CEA members include evidence-based supports and education for people with epilepsy, most times without wait. By letting your patients know about the availability of supports in the community, and in many cases access virtually through their local association, you help patients become aware of these programs as a first line of defense against the stigma and isolation many face. Community-based psychosocial supports, education, and social programs are vital for people living with epilepsy and their caregivers. By creating a more inclusive environment, stigma and isolation is reduced. This is necessary for improving confidence in disease management and overall life quality. Peer support groups provide a safe space for people to connect, share their experiences, receive emotional support, and learn coping strategies from others with firsthand knowledge and understanding of their situation. These networks are invaluable in managing the emotional and psychological impacts of epilepsy. Some efforts can be as simple as hosting a volunteer-facilitated members-only Facebook group. Education and awareness programs help individuals and their families better understand epilepsy, recognize triggers, and develop skills to plan and manage. This knowledge can lead to better adherence to treatment plans and improved health outcomes. Evidence shows that better educated patients are more likely to recognize when to seek medical attention. Community-based programs provide information about available resources such as financial assistance, legal rights, and employment accommodations. This can help individuals with epilepsy and their families navigate the complexities of living with a chronic condition, better assert themselves, and access the support they need to increase their wellness and sense of fulfillment. Building skills and resilience empowers individuals with epilepsy to take control of their condition and their lives. Training in stress reduction and self-advocacy skills are part of managing epilepsy. Empowered individuals are more likely to engage in proactive health behaviors and advocate for their needs within the healthcare system and broader community. Working in complement with healthcare providers, community-based programs help people navigate social, emotional, and practical challenges, leading to better overall disease management. Caregivers of individuals with epilepsy also need support and education. Programs offered by the Canadian Epilepsy Alliance members provide caregivers with the knowledge and skills they need to effectively support their loved ones, as well as prioritizing opportunities for respite and self-care to mitigate caregiver burnout. In closing, I want to express my heartfelt gratitude to each of you for your leadership and your dedication to improving the lives of those affected by epilepsy. The work you do in research, diagnosis, treatment, and disease management is invaluable. Together, we can create a future where people with epilepsy feel supported in every aspect of their lives. On behalf of the Canadian Epilepsy Alliance and its 26 member associations, thank you for your time and for including me in today's program. I wish you a very successful annual scientific meeting.